We're talking Christianity and leadership next year on our show. My guest, Dr. Emmanuel Emmanuel, is a senior medical doctor, and then Buenoki Populampo, and she's with the organizers of Young Christian Executives Conference. First of all, is every Christian a leader or potential leader? I don't know how you answer that.
Yeah, I would love to say the second bit. Every Christian is a potential leader.
Does the fact that you're a Christian make you a better leader?
There is that possibility. If you avail yourself to becoming a good Christian, there's so much we can learn from the Bible about leadership. So there's a potential for becoming a good leader or a better leader, if I must say that.
Yeah. Do you see, am I putting you on the spot? Do you see Christian leaders as being real, or they're just practicing or acting up?
From what I know on the ground and from what I've experienced so far, largely it tends to be an acting out. We have lots of problems and issues. The real issues, I think, are not being handled or tackled from the perspective from which they need to be handled. Yeah.
Okay.
So some tend to be an acting out rather than facing the real issue.
Yeah. I don't know if Dr. Chematingamwa wants to say something on that.
Yes. So I think essential leadership is creating the influence to achieve, an expected goal or outcome. And for the Christian, you stand in the best place because you have access to a lot of resources, spiritual and even around you, that you can harness and provide the right environment and the right influence to achieve the expected results. Problem is when there is a separation between the real tenets or what should be done or what we read and what is practiced out there. Because if we were really practicing everything that the tenets and the grace enables us to do, we shouldn't be here. So we've not yet gotten there. I think there's so much more we need to do, but it is still good that we come up with these things so that at least the younger generation know that there's so much more we can do with the resources we have, as Christians.
Sure. The church is growing, but people talk about bad leadership these days. What are we breeding into the society? There are a lot of leaders in the church.
Yeah, there are a lot of leaders in the church. And as you said earlier, it's the facade, if I must say, that largely we used to cover ourselves. Oh, I'm a Christian, so I don't have to do this, I don't have to show this, I don't have to show that. But if we are real with ourselves, the stresses we face daily, the issues of morality that are facing us on a daily basis, if we would handle these issues from the right perspective, if I must say, then we can handle these issues rightly. But if we just brush it under the carpet and say, okay, everything would be all right, but in reality we are not opening up the issues. If it has to do with the wayward child, for instance, is it coming from bad parenting in the home? Nurturing issues. Are we going to the core and looking at where the problem may have actually started, rather than just say that, okay, let's pray for the child, he or she would be fine. There are more issues than that.
What do you think the young people in the church are copying?
Well, so being in an environment, they will definitely pick up the things that they see around them. And so when you say the copy, now we are in a globalized world, so somebody can sit in this village or room and he's copying almost everything in the world through internet and all these modern facilities that gives us a window into other cultures. And so in the church, they copy, even if all they are seeing affluence and people doing so well, and they fail to go deeper and ask or learn how these things came to be. Did the people get it through hard work? Did people really burn the candle and really, build themselves up to this level? Or they just got it, through other means? So, yes, they see something they can aspire to, the challenges, do they really go to the source to find out what it is and how people got in there, or they just assume and then erroneously copy things that perhaps they are getting from their friends. And so now there's a greater responsibility on Christian leadership, because the world is now open. I mean, you say one thing to the youth in a particular meeting or church, but they are opened up to so many things happening out there. And as Master said, it's important to be real. Sometimes young people think that those leaders are not real. They don't really feel us, because we have our own world, we have our own challenges, but they come and they kind of talk to us on top of our heads, and they embellish everything in prayer. But really, would somebody sit with me, cry my cry, and you really get to understand me as a young person and the challenges I'm facing? In today's Ghana, of course, the challenges maybe 10 or 20 years ago are different relatively than what we are facing today. So they're looking for leaders. They're looking for people to look up to, role models. So you see, you go to some people's room and they have all kinds of icons in their rooms that they are looking up to. So young people are thirsty to look up to role models, to look at people who can really influence them and let them reach targets that they've set for themselves.
Okay, so how does the conference seek to change some of these things?
Foremost, we had to, we started off by sampling the views. One of our speakers actually has been in leadership for a while. He's been a registrar at a Bible college. He's pastored for over 20 years, and he's had lots of counseling sessions with people who have been across board, managers, people in ministry, children, adults, and several issues kept coming up, particularly with people in leadership or management positions, issues they face in the workplace. And as a Christian, then they are torn between the two. How do I handle these things in a way that it's not as if I'm pushing my beliefs forward, but yet again I'm maintaining my stance as a Christian, maintaining those values so that I don't fall somewhere between the two, but I'm making a particular stance. So, for example, the ethical dilemmas that have to do with moral issues in the workplace, and sometimes people are in need of mentors, people to tell them that do this, do it that way, don't do it this way. Someone to hold their hand, and as they go through, they are able to handle the challenges, yet become successful at the end of the day. So this program, looking at the topics we would treat, is we are hoping that at the end of the day, we would groom the Christian, the young executive, Christians across denominations, people in management positions, young people who are budding and have the potential to lead, wherever they find themselves. We want to target these people, and then aiming that at the end of the day we can provide some direction in terms of these issues.
Okay, Dr. Chematin is talking on work and your health. What about work and your health?
Yeah, it's a big topic. The American Psychology Association did a survey of stress in America, and they released a report February this year. And the top 4 causes of stress that they mentioned, the first one was got to do with money issues, and work occupied the second position. Then comes family, and then health, issues, like people are ill, and so work really is a key source of challenges to us, and impact on our health dearly. Stress is all over us. The issue is how one handles, the stress, so that it does not break you down. There's been countless reports, and we've had stories of people who have had ill health because of work or because of stress that they get from work. You sit in a consulting room and you find young people coming with hypertension, coming with diabetes, coming with other stress-related issues which we didn't used to see in time past, because now the world is getting very complex, very fast-paced. You need to meet deadlines. People sleep late, wake up early.
And these days, people are even afraid they would lose their jobs. So
exactly.
Everybody's trying to do something extra.
There are mergers, there are acquisitions, there are layoffs. You don't know what's coming next tomorrow on your desk. So all these things are creating a lot of stress. And typically for young people, research is showing that when stress is not handled well, it has a great impact on our cardiovascular system. So that's our heart and, our blood vessels and all that. And also on our minds, so depression and anxiety issues, and all these culminates into very dire health consequences, which you can just lose it in the heat of the work. And I know we have examples of people losing it even on their job. People just collapse at the workplace, or the heat is so much intense. So it seeks to explore. It seeks to bring this thing out there. Perhaps people know, but it's been glossed over. But how do I really combine the demands of today's workplace and still keep my health, so that you don't pay with your health? Because your health is all you got anyway.
Doctors do better with that, don't they?
Yes, I mean, doctors are stressed, but they find a way of maintaining their health. Because, as I said, if you're not healthy, it's gone. You cannot wake up to go and do the work.
Sure. When is this happening?
It's happening on the 22nd of August, just the Saturday, at Enjoy Hotel. Yeah. And
where's the hotel again?
Enjoy Hotel at Sakumono Estate.
Okay.
Yeah. Yeah, it's close to, it shares, the hotel actually shares a boundary wall with Hope Congregation, Sakumono Estate.
Okay,
yeah.
so who can be there?
We are targeting young Christian executives, but if you're not Christian and you would want to come, it's open to you. When we say young, we are targeting to people who are aged about 40, but then there are some dimensions to it. You could be 40 and being a middle management level position. You could be maybe 40 and be in a senior management level position. You have people working under you. You could also at the same time be a mentor who have people under you that you are training or bringing up. Okay. Looking at the issues we treat is open up to all these people. If you have at heart to improve your leadership skills, there are some, you buy into the issues you are treating. For example, one of the speakers is going to talk about a look from the top downward. He is a senior manager, CEO, have lots of people under him whom he's grooming. He's going to talk about the challenges and the issues they're facing and how he has helped so far to bring some of them up. And we also have another speaker, Mr. Isaac Denchi Kranting, who won the initial Apprentice Africa Awards. He's tasted success along the way. He's met challenges, but yet he's still keeping his head up. We want to hear from him. What are some of the issues that he faced, and how was he able to surmount all of these things and still maintain his stance as a Christian? He was excellent, being excellent in your community, at church, at home, at work, at the organizational level, across board.
This sounds expensive. How much will it cost?
It's costing 150 Ghana cedis. It's covering materials, meals, and everything, the whole ambience of the place and everything.
It sounds expensive, the details of it, but the money is cool, in my view.
Yeah.
Okay. All right, so it's on Saturday.
Yes, on Saturday.
How can people get in touch with you then?
We have our numbers, and because of the time span, we were targeting 100 people, and so far we have about 70, so we have just 30 more slots left. So you can call and then confirm. The 70 people have actually called and confirmed their booking. Looking at the time span, you can just call and then pay upfront when you come on Saturday.
Okay.
Yes.
All right. Is there a website they can go to? Otherwise, if you can give a quick number.
A quick number. The number is 020-743-8904.
That was really fast.
020-743-8904 and 0246-355-441.
Okay. All right. Something that you wanted to add?
Yeah, so I would say that though we're targeting 40, even if you are below 40 years and you are in, as a leadership position, aspiring to become and learn, it will be invaluable.
All right. Okay. Thank you so much for passing through.
Thank you.
My guest, Buenoki Popolampo, is with the organizers of this particular conference, the Young Christian Executive Conference. And Dr. Emmanuel.atani is a senior medical practitioner. He's speaking on work and your health, which I think is really, really important. So thank you guys for passing through. Michaela Anderson, my colleague, has been touring some health centers to see if the doctors are back at post following the ultimatum from the health minister. That deadline was today. Go back to work. Are the doctors still sticking to no conditions of service, no work? Are you on strike? Okay, don't answer that. Stay with us.
ultimatum given by the Health Minister, Alex Segbefia, for striking doctors to return to work expires today. We've been sniffing around some hospitals to find out whether doctors have reported to work and are attending to patients. Well, we are here at the Mamobi General Hospital to find out the situation here. Information we've picked up so far points to the fact that patients have been left stranded. Let's go in and check out what's happening.
My name is Abdullah Mohammed.
And how long have you been here?
I've been here yesterday night.
What's happening to you?
Somebody hit me something. That was this today. So I come to this hospital and they show it for me. And she tell me I should come yesterday, the evening 9 o'clock. When I come, they say the doctor don't feel fine. So I don't have doctor to take care of me. So I decide I stay for Santa Maria. And my transportation, I can't go and come back. So I sleep here. And to now, we don't have a doctor.
This is the OPD section here at the Mamobi General Hospital. The place looks abandoned. There's virtually nobody here, but some few nurses I've been interacting with, but who do not want to speak on camera, tell me doctors who were supposed to report to work yesterday did not show up, but they are hoping, since today is the expiration date for them to report to work and attend to patients, they will.
As I came on night yesterday, and we did not work with any doctor. I work at the records office. We did not work with any doctor till this morning.
And none of them is here?
No, I've not seen anybody.
And how have you been coping?
Well, once there is nobody around, I mean, you also just sit and wait. That's all. There's nothing you can do.
What's happening to the patients?
They come and go. I'll be happy if they come back, because people are sick. When they come, they just go back, and it's disheartening. So I'll be glad if they come back.
But if the doctors don't return to work, what happens to the directive from the Labour Commission for them to take steps to call off their strike? Michaela Anderson, Mamobi.